Thank you for taking a little bit of an abbreviation here from what we had planned, but we are back on track. Thank you all that are online and joining us here as well. I'm pleased to kick off our next set of sessions here. Our first one's Framing Wellbeing in College Campus Setting, Emerging Trends and Looking Towards the Future. American College Health Foundation, with generous support of the Aetna Student Health, had completed a white paper on innovations in well-being in the college setting. This white paper examines the state of the field of health and well-being as a diverse sample of institutions of higher education, looking at well-being initiatives through the lens of serving both students and employee stakeholders, reveals new trends in creating cultures of care on campus. This session will present some major themes and lessons learned and questions for the future of well-being on campus. This white paper is actually coming out this week, and so will hopefully be a little bit of a preview and sneak peek. It's my pleasure to introduce Dr. Wendy Shanahan-Richards, Chief Medical Officer at Aetna Student Health.
Well, thanks, Devin, and welcome back from lunch, everyone. When I looked at the title of our conference today, Inspiring Hope and Real Solutions, I just knew that, as always with ACHA conferences, we had a lot of great information coming to us and a wonderful day ahead of us. And certainly I've been inspired this morning by all of the different initiatives and discussions and presentations that I heard, and just so happy to be here. I am really pleased and excited to be here as kind of the face of this white paper effort that Devin referred to. I certainly am not the only person involved in the study. We have, I want to first thank the 10 schools that very willingly and enthusiastically participated with us. It was just an amazing experience to work with them. Also, too, we had senior leadership support from both Aetna Student Health and the American College Health Foundation, and we had a bevy of very experienced subject matter experts in the field of well-being in college and universities, as well as wonderful researchers, writers, and project management team. So I'm going to be sharing the results of our study today, and this study culminated in a white paper, as Devin mentioned, and it will be published this coming Friday, and it will be on the ACHF website. It will be accessible by anyone who cares to access it through a PDF, as well as if you'd like to take a look at it on the web first, you're welcome to do that too. So very excited about that. So I could not do justice to the results in the 20 minutes, now 18 minutes that I have left to present today. So I really would encourage you to dip into the white paper when you have a chance and really look at all the wonderful things that the 10 schools that we worked with are doing today. And I want to just kind of set the stage a little bit for what the study was. What it is and what it was really for us to understand and then share with all of you the range and framework of well-being models that are currently in progress and currently deployed on various college and university campuses. What it is not and was not ever meant to be was hypothesis testing. It was not meant to be an assessment or a judgment or ranking of who had the best. Definitely that was not the purpose of this. The goal really in the end was to provide ideas and to stimulate collaboration in really the spirit of us all supporting the evolution and the continued evolution of well-being across campuses. Okay. So I want to tell you a little bit about the collaboration, about the two organizations that collaborated before I dive into the results. Aetna Student Health is the organization that I'm part of, and we are a CVS health company at this point in time. And our role really is in delivering innovative benefit plans and products and support for the schools that we partner with. And then ACHF has a mission of improving health and supporting and success for college students. So you can see the mission statement up there, very compelling. I can tell you that even though we're different organizations, everybody on the team has a huge passion and very passionate around well-being, and we're excited to be part of this and support it. Okay, so again, I will not be able to provide granular detail. I'm happy to answer questions, certainly, after the session. But I'll just highlight some elements of the project and some of the high-level results. And hopefully this will inspire you to go in when the paper is posted on the site and dip into it a little bit more. So as I mentioned, we had 10 schools that participated. It was a 9-month qualitative study, and so I emphasize the word qualitative again. We didn't crunch numbers, and we didn't evaluate, and we didn't study outcomes in this particular phase. The schools varied in size and location and other attributes. So some schools were public schools, some were private, some had multiple schools, multiple campuses as part of their system. So again, a lot of variety across the schools that worked with us. The research methodology that we used consisted of key informant interviews, focus groups, as well as archival documents that the schools very willingly shared with us to talk a little bit about their structure and where their well-being programming was housed and things like that. We also were able to divide up the 10 schools into kind of 3 types of models. The student serving model, so the individuals that we spoke with were really speaking directly about the well-being focus for their students. We also had employer serving models, schools with employer serving model, where it was strictly focused on employees, so faculty and staff. And then we had 2 schools that deployed a hybrid model, and that is where, when we say hybrid, we're talking about schools where the well-being programming in the model was coordinated out of one centralized functional area on campus for both students and employees. We also heard from the schools that have a student serving versus employee serving model that they're really kind of making efforts to work toward more of a hybrid coordinated model across the campus. So here's a summary of findings here. And I don't know that any of this will really be a surprise to you, but so there was no widely accepted consensus definition of well-being. I don't know if anyone's surprised by that, but feel free to raise your hand, and I'm not seeing any hands here. So, and that's okay, because when we talk about innovation and we talk about relevancy to the student body or the employees, faculty, and staff, that makes perfect sense. There also we found, again, in the schools we worked with, there's no standard approach to conceptualize, practice, or adopt a particular well-being model. So, again, all very different and diverse. The engagement was impacted by the school's philosophy. So I'll talk a little bit more about this because I'm going to get into each one of these in a little bit more detail in a moment. But if the school's philosophy, and this was very much supportive of well-being, regardless of the number of dimensions or what have you, there was much more. It seemed to be much more engagement, not only by the students and the staff, but by senior management also, because it really became a part of their culture. And many of the programs are addressing health disparities and health equity. And then finally, the majority of schools that we worked with are not currently formally quantitatively measuring or evaluating the impact of their model on the overall well-being at this point in time. But again, there's an evolution toward that, and a number of them expressed great interest in knowing more about how other schools measure and evaluate the impact, and not only really for making a case for funding, but also too because they want to make sure that all of the resources and work that is going into maintaining a well-being model and evolving it will be relevant to the population. So as far as the definition, as I mentioned, throughout the study, we noted there really was no clear consensus definition. It was very clear to us from the beginning. But the other thing that I thought was interesting was that coming to a consensus, either across stakeholders of the school or across from school to school across the country, was not a priority for these schools. They also utilize the words wellness and the term well-being interchangeably, but we did notice more of a shift to the term of well-being. That being said, we did provide the CDC definition of well-being to them just to ground the study. So we weren't advocating for it. We were just saying, here's a basic definition that the CDC, has in place. Kind of think about that, but we'd like to know what your definition is. And some of them just didn't have a definition, which again is perfectly fine. In terms of a standard model or approach, just like there was no standard definition, we found that there really wasn't a standard approach, no standard model to conceptualize in practice. But we did hear a lot about, we believe we have a multidimensional, holistic model that we have today that we're continuing to develop. We had other schools tell us we don't really, but that's what we aspire to. We really want to kind of bring a lot more together. Doesn't necessarily have to be, housed in one area on campus, but we want to bring stakeholders together. And then there was reference to the socio-ecological model too, because there's really a big interest in learning how to coordinate and talk about the interaction between an individual, other people around them, as well as the community, the organization that they're in, as well as society. And so a number of the initiatives, really were kind of cross-cutting across the various sections of the socio-ecological model. And again, this is something that the schools told us they really are wanting to really, move forward as kind of their next steps. And the wellness wheel, with varying dimensions, I think we saw, everything from 3 or 4 to, 9 or 10, again, varies across the schools. So the fourth section of results that I'll talk about here is around health disparities and health equity. And we defined, from the get-go of the study and the interviews in the focus groups, we defined health equity as everyone has the support to be as healthy as possible. And so that was, kind of the baseline definition that was used to get the discussion started. And the schools are addressing this either directly, and all of them actually are addressing it directly through activities on campus supported by the school, but also increasingly indirectly through community involvement and community coordination. When attention to health equity and health disparities was part of the strategy, it was really shown to be for both students actually and employees. So it's not just for students, but was focused on students and employees together. And we noted that the multi-campus system school that that participated in the study really had the most intentional kind of focus on this at this point in time. And some of the examples of innovations, an actual one-stop shop where their whole focus was to reduce barriers to holistic success, financial aid workshops, financial literacy workshops, so again for both the students as well as the employees, food pantry access, and emergency grants and aids, very, very important, very heavily emphasized by a number of our schools. We had a few other schools that set up a formal well-being office and have a program manager in place to specifically address issues around health equity and health disparities. And in terms of the last section, or the last component of our findings, measurement of impact. And at this point in time, there was no standard measure set. There's no standard methodology to evaluate the impact or the outcomes of the models that are in place right now. But again, stands to reason, as the schools are working on their definition and their model and coming to consensus around kind of what are all the components we should have, they actually are starting to think about and how do we measure the impact of this so we can make sure that we're doing the right things, so that we're doing all the right things and we're doing enough of the right things. Public health based, evidence-based best practices and guidelines is another area that is evolving in terms of being included in the well-being philosophy and the well-being models is another thing that we heard. And then including environmental intervention. So, campus community coalitions was something we heard come up more than once. Well-being ambassadors, these types of environmental interventions and the coming together of the campus, the stakeholders on campus, as well as the surrounding community or communities. So, we're thinking that, and what we're hearing is that measuring impact may then be driven by the framework that the school deploys, and that makes sense, right? So if you feel that these elements of well-being are very, very critical and high priority for your campus, you're putting together your model, you're deploying your model, you're working it into the culture of your campus. Following from that will be ways to measure the impact, almost in a continuous quality improvement style, to say, okay, this is working, it could be working better. What should we do to help improve that? So again, more of that coming, and it was just nice to see, as opposed to only talking about what we're doing now, our schools talked about what we're aspiring to do in the direction that we're moving in, the path and the journey that we're going to take. So before I close and tell you a little bit about what our next steps are, what we're thinking about our next steps will be at this point, I want to just outline a few other highlights of the study. We did find in the 10 schools that we worked with that traditional health education and health promotion is still the most common means to address well-being. There was discussion around centralized versus decentralized administration of well-being programs, again, for either students, for employees, or for both. Peer educators came up a number of times. We were told that this is very compelling, and that they have students that are very willing to be peer educators and peer supporters. More focus on students who participate in online learning, as well as other non-traditional students. This was another topic that came up. That schools are looking to really make sure that is included in their well-being strategy and their well-being models. In addition to students with chronic conditions. I know when I first started working in Aetna Student Health, I had colleagues that said, "Oh, it must be great to work with a young, healthy population." I said, "Well, when I was in practice as a family physician, I took care of a number of college-age students, and while many of them were healthy, some of them were not." And this better than me now, because you're all practicing and you're seeing students and working with them every day. A lot of challenges that maybe 15, 20 years ago, students would not have been able to not only come to school, but thrive at school. And then also too, faculty involvement was said to be very important. A number of schools were really trying to encourage that and move really more closely to including that in their model. And then finally, it was emphasized a couple of times that incorporating the principles of well-being and really seeing policies and procedures that govern activities on campus through the lens of well-being is going to be very important to carry everyone into the future. So I'm going to talk a little bit about what's next, and I was trying to think about kind of a final segue lead in here. And what I'll say is that to really be kind of look after my own personal well-being, one of the things that I do, and I sometimes don't get around to it every day, but at least a couple times a week, is I play jazz piano, and it's a passion for me. I love it. I played musical instruments since I was, I think, 5 or 6. But had never really learned jazz piano. So I started taking lessons about 6 years ago, and I was talking to my teacher, who is, by the way, very patient. If anyone lives in Chicago and wants a jazz piano teacher who's patient, see me afterwards. And I said, I just love jazz because, unlike a classical piece, which I love too, movement after movement, and I said, jazz piece, I can take a lead sheet and it has a beginning and end, and then I can just, mess around, do stuff in the middle of the piece. And he said, "Actually, no, you're wrong, Wendy." And I said, "Really?" And he said, "Yeah." He goes, "A jazz piece never has an end. It really doesn't." And I said, "Well, but there's the end, there's a last chord. I mean, unless you want to segue into another jazz piece and change his keys, and that gets me all mixed up. But he said, no, he said, actually, the reason jazz pieces don't have an end is because if it did, there'd be no more innovation. He said, so they never have an end. And so, I think all good things don't have an end. And I'm hoping that that's going to be the case for continuing study that we've been collaborating with, the ACHF on. So what's next? So a couple of things that we've been talking about. We're in the process of discussing this, at the moment, actually. 3 areas really for possible future research and collaboration. Again, collaboration with our colleges and universities. So measuring impact. We've talked a lot with our schools about, if you were going to measure impact, how would you approach it? Do you think you need to measure impact? And if so, why? So that is a topic, I think, of study that we'd like to expand upon, really kind of analyzing not only the impact, but also more incorporation of the socio-ecological model that a number of schools referenced. And really kind of looking more deeply at the hybrid well-being framework in the schools that have that or are moving toward that. A second area for further research and study would be around health equity. Again, very, very important priority for our schools. Outcomes of the well-being initiatives on the underrepresented populations, the non-traditional student populations. And how a culture of well-being is addressing disparities across a campus. And then finally, community. Community in terms of how can both the school and the community benefit from the existence of and the maintenance and the evolution of well-being models. How do campus community coalitions work? Are there other things that can be done or other initiatives that can bring, the 2 areas together to the benefit of everyone? So those are some of the things that we're noodling around right now, and we're hoping to have kind of more definition around that in the near future. But I just want to say that I've been privileged and honored to be part of, again, the evolution of supporting all the great things that you're all doing on your campus, and everyone who's streaming in online, and all the schools that maybe couldn't participate today. So thank you very much.
Before you leave, Wendy, we do have one question for you, but we'll let you off the hook. So one of the questions is the absence of negative emotions realistic in well-being? And they're saying they're not sure that one can appreciate the good without the bad. What's your perceptions of that?
Yeah, I agree. So I don't think, if I'm understanding the question correctly, I don't think that, the purpose of any programs was to, or any of the models is to say that everything's going to be perfect and everyone will be, happy all the time and feel, that we know there's challenges. And a lot of what I've heard today is really kind of work to help, again, resilience. As Sue said and others said, create that resilience so that you can manage the challenges, because we know that life is not without challenges. Great. Thank you.
Thank you so much, Wendy, for a wonderful presentation.